Myxoid, some kind of. Then Dr. Shelton talked to pathologist, I think you probably already know they call the sarcoid tumor, right? And then they presented your case at head neck tumor board last week or so, but I wasn't there, I was out of town. So they recommend either surgery or consideration of radiation therapy. I probably will not recommend the radiation, given this is a sarcoid tumor, right? Based on the information I have, it's very limited data to support using radiation to sarcoid tumor, right? Sometimes we do use radiation for benign disease, for some bony disease, like Langerhans cell, they call the LCH, that's kind of benign disease. Yes, we do use radiation to treat. That's one very rare situation. We use radiation to benign the tumor. And even this sarcoid tumor, is kind of localized, kind of a benign process at this point. Sometimes it can become malignant or the behavior is really aggressive. That point probably need radiation. If that's the specimen show the low grade and the localized benign disease, you are young, the indication of radiation is very limited.
With radiation, because lately, I've been having like confusion and memory loss lately. Like, I'll think to talk about something and then I completely forget it. With radiation, does it do a lot?
No, it's not going to do anything on your memory. If radiation is localized, to that Peters area, and the radiation dose is not going to be that high, right? Even for surgery, from all the literature review I have, that is limited surgery. It's not going to do any major operation, So if they can do the surgery, then I have more information to know what's the kind of this one. Is it the sarcoid or LCH, that kind of Langerhans, that's that kind of the disease. Then if that's Langerhans.
If they do the surgery, would all the cancer cells go away, or would I have to?
No, you need to talk to Dr. Shelton.
He didn't seem like he knew.
No, it's not completely resect because the location, the right in the skull base, is not going to have a radical surgery. You'll probably just remove the most tumor and just watch it. And if continue progression or if biopsy, the final pathology shows the different type of tumor and that is indicated for radiation, then I can treat it with RT. But for sarcoid tumor, the data is very limited to support radiation from this disease.
Do you have a referral or a recommendation for a neurosurgeon? Because since my hearing has gone up, it's made me kind of hopeful. And the way that Dr. Sheldon wants to do the surgery, he wants to cut right through my cochlea.
Yeah, that's the best way. I think Dr. Shelton is I would consider he's the best surgeon. He's a neuro ENT surgeon. So he works for the ENT and and the neuro in that area. I think I cannot think about somebody else. So you need to talk to him, what kind of procedure he's going to do. Right. So the thing is that in order to get all this tumor out, probably the surgery is the first choice. And you are young, the radiation therapy, there's a risk of radiation could cause another cancer also. So for benign disease, I'm not that aggressive to use radiation. For this, particularly for this sarcoid tumor, there's no data.
So why would the board of surgeon?
No, that's why that's a wonderful option. That's why I send you to me, ask my opinion, and I probably
radiation first, right?
No, I would recommend surgery first.
But why would they ask her to come see you?
No,
Or-
that could be one of the options. Sometimes we do recommend the radiation.
Mm.
Yeah. But on your case, I probably would not recommend. It's still resectable.
I feel like I don't want him to do the surgery anymore.
Well, he's great. He's the best surgeon.
That's what I've read about him,
Yeah.
and he
Yeah,
has
he-
really good,
The
knowledgeable.
way
Yeah.
he wants to do this because ENT is because we met with the neurosurgeon a couple weeks ago, and the neurosurgeon explained to us with ENTs they'll do like the fastest and the easier operation, and with how my hearing improved a lot, I'd rather go with the longer surgery where the neurosurgeon will go at the top.
Yeah, it's up to you. You know, there's nothing wrong. It's not the malignant. It's not like a spread at this point. So you can just get a second opinion from a different center or different doctors. I think it's fine. Just go to talk to people.
But you would recommend her.
I recommend the surgery. Radiation treatment is we don't have strong data, and that area is acceptable. And then you can just wait and see. Because radiation, most time we don't want to use radiation to the benign disease or for the younger patient, because
Right.
the risk radiation could cause some serious cancer down the road. If that's resectable, have some kind of a surgery can make you can live with that. It's like some other benign disease. Unless if they do the surgery, then turn out that's a different kind of a tumor, right? And that kind of tumor is indicated for radiation. Then I will feel comfortable to treat, but not the first treatment for sarcoid tumor for such a young lady. Also. Let's just talk about the options. Come to see me, ask my opinion.
Yeah.
I'm not really aggressive for such benign disease.
I want a different doctor.
And the limited surgery, see, they just did a biopsy and your hearing has improved. Then they maybe just go out to clear up the area. Then then just watch that area by the regular imaging study. If will continue progress, like some. If down the road is not resectable, then we consider radiation. So my radiation is not the first option. Trying the non-radiation therapy.
Yeah.
Does that make sense?
Uh-huh.
Right. You don't want to. Once we give radiation, your body will remember.